Hi everybody, welcome back this week to The Naked Doctor. I'm Dr. Tammy.
And I'm Lauren.
We have a great show for you today. We have a continuation of last week's show, and we made the big announcement about Lauren being pregnant.
Having a baby. But during that show I learned something that I didn't even realize, is that the postpartum depression is more than just postpartum depression. You know, it's something that lasts for years, and it's not just depression, it's just postpartum hormone chaos. Is that what
Yes.
Is that what it was?
Yes.
Yeah.
It's so funny because we're always talking about the way, the universe kind of lines stuff up, and we talk about these little synchronicities, what people call synchronicities, all the time. But it's just, what was that post you had the other day, that it's not coincidence, it's you understanding your power?
Right. At some point you'll stop calling it a coincidence and realize how powerful you are.
I love that.
Right.
So anyway, there's a patient in today, and she was just talking about seeing one of our last shows, and she's talking about postpartum, and she's like, is it possible, just the timing of this was crazy, she's like, because my baby's 19, and she says, is it possible that I, instead of just had postpartum depression, because postpartum means after the delivery, is it possible that I had postpartum hormone crash? And is it possible that it's lasted this long? And I said, absolutely. And that's just what we talked about last week, as we were kind of tying up that, and we kind of realized that there wasn't enough time to talk about all things hormones related to that.
Right, but that's a very, very huge topic for so many women. And I guess men too, because, it's a part of everybody's life. You know what I mean? Your wife, or whether it's you or your parent, that's the way that affects you. You have a huge impact on your entire family. So it's like, if mom ain't happy, nobody happy.
That's
right? And so after having a baby, whether it's, you're depressed, or it doesn't have to look like that. It looks different in everyone. And I didn't realize that you could have so many, like that hormones, even 5 years after, post baby, that, postpartum, that you could still be having, postpartum depression or postpartum issues, because that's such a long time. And it's crazy. And you wouldn't really think, people probably don't think immediately like, oh, it's because I have a baby, or it had something to do with that. They might think like, oh man, I had a baby and it was all done. You hear that a lot. It's like, once I had kids, I was, I gained all this weight and I never could lose it back. That's one of the many issues I know that dealing with after pregnancy and stuff. So
we're going to do a fun little blackboard segment, and we're going to do it a little different than I usually do it, just when I'm just standing up and talking. What I often do in clinic with patients is sit down and draw pictures, because I'm a very visual learner anyway.
That's awesome.
But we're going to kind of do that interactively, and I'm going to share with you why that happens, why it can be years and years and years. And when you think about after menopause, which is what most people come to see us for, those complicated hormones, it's like it just cascades down and down and down. And so why wouldn't you think, if somebody could have postmenopausal, or going through the change, symptoms for 10 or 15 years, why couldn't they have postpartum symptoms for 10 or 15 years?
Yeah, that makes sense. You don't really know until somebody kind of slaps that information in your face. You're like, oh, duh. You're like, that makes so much sense that would be something that you would, a place where you would really try to narrow down specifically, how to get your body back on track. Because that's a huge thing. Your body going through pregnancy, you make a baby. I mean, it's like all this stuff that clearly your hormones are crazy, going all over the place. You have your baby, and then, sometimes it's all hell from there.
Well, and a lot of women say, I couldn't lose the weight after the second baby. Yeah. And a lot of times they don't have those hormone changes that they have after the first baby, that they have after the second baby.
Yeah.
And that's
probably has something to do with age, maybe.
Well, just more decline, more stress on the body, more decline as you're older. You're saying that everything's different with this pregnancy.
Oh my gosh, it's 100% different. I'm like, does it mean it's because it's a boy? Because I had a girl before? Am I having twins? I don't know. And then I'm like, oh wait, I'm 10 years older also. Like, so,
different stress on the body, different everything's
different. My hormones are completely different than they were at 19 when I got pregnant the first time. So so I'm kind of interested to see how this whole process goes, and then my postpartum everything, when I get, how I get back into my who I am and feeling like me, so yeah.
It's probably time for a little break. So we're going to talk a little bit about, when we come back from break, about how it's a lot different, I think, for some people who, you're very motivated, you work out all the time, you know all the right things to do, and you have access to all the hormone tricks and everything. But I think one of the problems is that a lot of people, when they're trying to come back from something like pregnancy, when they have hormone changes or hormones that are messed up, they lose their motivation because they just don't feel good. And so we're going to talk a little bit about that as well with our little Blackboard segment, and we'll be right back with the Naked Doctor.
When I came back to see Dr. Tammy in January, because of the month I had the month of December, we were just having a discussion and what I might be able to do. And I said, I'm just going to be honest with you. I've made an appointment tomorrow to go, check into this stem cell research. And she said, well, we do that here. And it was a no-brainer for me because I already had a relationship with her and trust her. And so that was when we decided to try the treatments, and I signed up for the 3-month program, and I've just been totally pleased with the results that I've had, because I've not gone back to that where I was just in such excruciating pain, and we've made great progress. Before we started the program, I told her I could fall asleep being asleep. I was just so run down, tired. I was depressed all the time. And I just find myself not having those battles like I was, where there was a constant battle. My conditions are just so extreme that the improvements that I've made have kept me from feeling like the best result for me is just death. And to me, that's been the God-sent blessing that Dr. Tammy has given me, is that I don't feel that way. And to me, that's worth every penny that I've spent. And, I can't say enough about this lady and her staff and what they've done for me.
I have osteoarthritis, and, the arthritis medication that you get regularly will cause your kidney function to go down, and my kidney function had started going down, and so I knew I needed to do something different. I've been seeing Dr. Tammy for about 3 months, and she's been doing stem cells in my knees, and it's like a miracle. She absolutely hits it every time in the correct spot, and I am pain-free now, and I haven't been pain-free for about 10 years. I can go upstairs without pain. It's wonderful. And I send everybody I know to her, because she's done such a wonderful job for me, and I just appreciate it so much.
Welcome back to the Naked Doctor. This is our interactive Blackboard segment. And it's funny because all my patients know me, or anybody that works with me know that I'm, like I said, a very visual learner and a very visual teacher. And I think the way you teach and learn is super important, because not everybody can understand. And I always tell people that when they come to us for the first time, you always have in the back of your mind, what are you selling? I'm like, okay, I'm very clear. What I'm selling is education and empowerment, because you understand this stuff, you got your power, and you don't need me, you don't need Lauren, you don't need anybody, and you can always take back your power, take back your health once you understand this stuff.
Right. It's not like putting somebody in a position where it's like they need you. Kind of like, pharmaceuticals, where it's like, here's this, but now you're dependent on me. Not just for this, but for what comes with that, with the side effects of this, that, and the other. With you, it's like, which I love, I really, really love. And people, consistently you hear patients, it's like, whoa, I've never understood it like that. And I'd love that it should make sense of things, because you do that for me too. Like I had no idea how much I had to learn, and I'm still learning all the time from the stuff that you teach and the way that you do things.
And I'm still learning all the time too. Yeah, I'm constantly reading.
I just love it, and I love the way that you do this. So let's get into that.
Get right into it. Okay. Well, I always have to draw a little person here, and I usually kind of start this way with here's the body, and not very artistic here, but we have up here the brain, and we have a little thing called the pituitary gland. Pituitary. And it makes lots of hormones that tell all the other hormones what to do. So we have the thyroid, and then, so we'll write thyroid. And then we have the ovaries, or in men, it'd be the testes, but we're talking about postpartum depression today. So I'm going to talk about female hormones now. And then you have the little adrenal glands up here. So we're going to kind of keep it to these main organs right now that make these main hormones, and they all interact. So what happens is this gland up here tells the ovaries what to do, and then the ovaries make more or less hormone. So the word progesterone means progestation, and this is progesterone, and this is really when we're talking about postpartum depression, or we're talking about a lot of female hormone imbalances, and pretty much every hormone imbalance that you can name, endometriosis, PCOS, all are a progesterone deficiency. So progesterone, this means gestation, and gestation means pregnancy. So this is the pro-pregnancy hormone.
Oh, I didn't know this part.
Yeah. So when this declines, you can have all sorts of problems. You can have trouble with fertility, and that's what our last show was about, getting pregnant. And there are lots of ways to supplement progesterone naturally that are safe and easy. But after pregnancy, what happens is the ovaries are making a ton of progesterone to promote the pregnancy. I'm going to draw a little picture here in just a second. But all that progesterone sort of gets completely saturated in the system, in the baby system, and then afterward, you're not making as much progesterone. And when you get that dip, that causes that hormone cascade. And so the adrenal glands try to make more progesterone, and they try to keep up, but then they can't. And then the thyroid starts to go, add a little stress from being a little bit older with pregnancy, more life experience, more bills, more whatever. And the adrenal glands can't keep up, and then you start to have thyroid crashing, and then people start gaining weight. So it's kind of a vicious cascade.
So like the adrenal glands, which is like where adrenaline comes from, right? So is there a correlation there with the adrenaline that comes with having kids? You know what I mean? How when, like, I guess, so like adrenals and stress, are those, like, do those kind of play in the same boat?
They do, yeah. The adrenal glands actually make multiple stress hormones. So if we were to break down the adrenal gland into 3 different segments, one of them makes your adrenaline, your norepinephrine, and your sympathetic, parasympathetic, fight or flight response. So that's your adrenaline. There's one that regulates your blood sugar, and then there's one that makes all the same hormones that your ovaries do.
Gotcha.
So yeah, these are way overworked sometimes, especially with lots of stress in life.
So if one is off balance, it's going to throw the other two off balance.
So one of the things I like to share is if we draw the little graph, and I have to use the green pen because little O and Lainey are, what we call Lainey our nurse. She's everything. Her son comes up here and plays on the chalkboard sometimes. But if we were to draw out a graph basically of 28 days, we're talking a female hormone cycle. The first part of the cycle is driven by estrogen. And so what happens here is that E for estrogen. Estrogen causes the lining to build up. And if you fertilize, you get this feedback. If you have an egg that gets fertilized, you get pregnant. And if you don't, this feedback loop happens about this time, which is day 14. We call that ovulation, when you pop out an egg, when you're most fertile. And then progesterone kicks in, and it calms down this part of the cycle. So what happens is when you get this progesterone crash, if you will, after it's all saturated, all your cells and receptor sites after pregnancy, now you just keep getting estrogen, and there's no progesterone to calm that out. They'll have heavy periods, they'll have endometriosis, they'll kick up PCOS, they may have more fertility issues.
Maybe more susceptible to cancer.
Absolutely, because different kinds of estrogen are more susceptible to cause cancer. Not all estrogen, so we don't want to...
Right, not scare anybody.
Yeah, because it's all about balance. But this is where the weight gain comes in. Same thing with menopause. Women start dipping their progesterone. It's kind of like a postpartum. And I've seen women gain anywhere from 10 to 15 pounds a year after menopause because this estrogen goes up and then the progesterone is declining. And then what happens at some point with menopause, after the adrenals and the thyroid crash, then the estrogen crashes too and they start having hot flashes. But the weight gain and the sleep issues all start to be affected as well. And let's not forget, progesterone is huge for sleep. So if you are not sleeping well, by definition, whether you're a man or a woman, you've probably got low progesterone.
So it's kind of like whenever there's a certain part in your cycle where, like for a female, where you're so tired, like because when you're actually on your, like where in this cycle actually would your period come into play? Like where?
So what happens is when this progesterone kicks in, it causes the lining to start sloughing. But we actually, this part here would actually be where you have a menstrual cycle,
Okay.
and then it starts all over again.
Gotcha. Okay. That makes sense.
So this day is day 1 is considered the first day that you start bleeding. So this is kind of the wraparound here because it'd be the first part of this cycle where you're bleeding.
Gotcha. Okay. So with a, let's say somebody postpartum, right? Like what would be like a solution for, is this like the main really thing that you see?
Oh, right. Yeah, exactly. What's the solution? So what we usually do is we go through and give them some natural progesterone to kind of build up this peak. Here, days 11 through 21, they take extra progesterone during this time. A couple of cycles, so get them right back on track, get all that leveled back out. And then after about 3 months, usually they're on autopilot again, unless some big life stress or a thyroid thing happens or some big adrenal stress or something like that. But usually a couple of cycles of that's enough to fix it.
What about somebody who is taking birth control? Where would they fit into this, or how would birth control affect somebody's estrogen progesterone levels?
So birth control basically causes a false effect of elevated, you're basically giving somebody estrogen and progesterone in elevated levels. So it goes up and it tells the brain we have plenty, don't make any more. There's your levels right there. You got none. When we check women who are on birth control, they have no estrogen or progesterone because it's all suppressed by the high levels that we're giving them of synthetic hormones.
Which makes sense on why a lot of times with birth control you don't have a sex drive.
Yep. Testosterone crashes too. Yeah.
Man, wow. Okay.
Yeah, and a lot of people do gain weight because the balance is completely off. So, that's a real thing when people say I gained weight on birth control. That's a real thing.
Well, because like if you're basically given synthetic, if these are at zero, that's got to affect also your thyroid on some level.
Absolutely,
right?
Because they all feed back with each other. All the
Right.
hormones, all the receptors they're all competing for each other. So it's all about balance. It's a big orchestra.
Yeah. Wow.
Cool.
There you have it. See,
There you have
she makes it make so much sense. And gosh, I love this. This is amazing.
Love it. All right, so thanks for watching this segment. We'll be right back with the Naked Doctor.
Hi everyone, Dr. Tammy here with more tips to help you on your journey to feeling fabulous and reclaiming your health and wellness. Are you feeling the pain and embarrassment of gas, bloating, diarrhea, or irritable bowel syndrome? Battling hormonal imbalances such as PMS? Diagnosed with chronic fatigue or fibromyalgia? Feeling depressed? These symptoms and many more may point to what we call leaky gut. The intestine or gut naturally allows very small molecules to pass through it and absorbs vital nutrients from them. Regulating intestinal permeability is one of the basic functions of the cells that line the intestinal wall. Even if you ate veggies from the Garden of Eden, organic and rich with nutrients, you would still have to have a perfectly healthy digestive tract, stomach, and intestine to absorb the nutrients from it that you need. In sensitive people, gluten, a protein found in wheat, can cause the gut cells to release something called zonulin, a protein that breaks apart tight junctions in the intestinal lining. Other factors such as infections, toxins, stress can also cause these tight junctions to break apart. Once broken apart, you have leaky gut. When your gut is leaky, things like toxins, microbes, undigested food particles, and more can escape from your intestinal tract and travel through your body via your bloodstream. Your immune system marks these foreign invaders as pathogens and attacks them. So what is causing leaky gut? The main culprits are the wrong foods, infections, toxins, and gluten. Inflammatory foods like dairy or toxic foods such as sugar or preservatives may play a role as well as excessive alcohol. The most common infectious causes are yeast, intestinal parasites, and small intestine bacterial overgrowth. Toxins come in the form of medications like Motrin, Advil, steroids, antibiotics, and acid-reducing drugs. There are also environmental toxins like mercury, pesticides, and BPA from plastics. Stress can leak stomach acid into the intestines. Hormone changes wreak havoc as well. So, what can be done? Well, the good news is there's a solution to healing leaky gut and to reclaim your health. To keep it simple, I have developed a 4-step protocol that includes, number 1, remove foods and factors that damage the gut, such as sugars, grains, dairy, and GMO foods, non-organic foods, acidic substances like coffee, and drugs like ibuprofen, acid reducers, and non-essential antibiotics. And you can ask your doctor about medications you may not need. 2. Replace with healing foods like bone broth, fermented vegetables, coconut, and super seeds like chia or flax. Also, consuming foods that have anti-inflammatory omega-3 fats are beneficial, like grass-fed beef, lamb, or wild-caught fish like salmon. Number 3, repair with specific supplements. These include specific amino acids, magnesium, digestive enzymes, probiotics, and anti-inflammatories. Certain amino acids act like gut spackling and protects and coats the intestinal wall, as well as anti-inflammatory, like aloe vera, licorice, resveratrol, and turmeric among may be recommended. Digestive enzymes ensure that food is fully digested, decreasing the chance of undigested foods traversing the leaky gut and causing the immune response. Magnesium relaxes smooth muscle in the gut, keeping things moving. Number 4, rebalance with probiotics. Last, but most importantly, this is the vital part to healing your gut. You must rebalance with the right probiotics. Many on the market have the wrong ratio or have ingredients that may make your issues worse. It is essential to get at least 100 billion units of the right ratio of bacteria. If you can follow the above protocol, you are well on your way to healing your gut for good. Here's to reclaiming your health and wellness. We're just better at helping you feel better.
Welcome back. Thanks for joining us this week. Hope you've learned a lot, and we've had a lot of good information come out at you. Mm-hmm. We want to make a few announcements.
Yes, one of them is that if you like my luscious lips, Dr. Tammy did them, and I absolutely love them. And we are having a special for Valentine's Day. So you can go to our social media to do that. But it's basically you're getting a really super awesome deal to get injections. So like I said, go to either the Naked Doctor Facebook page or Healing Art Center's Facebook page, or you can go to healingartcenters.com, and we'll have a link posted on there as well to get our special.
And one thing we talked about the lips, having wonderful, amazing lips, is sometimes best done in stages, because oftentimes what I find is people want those big lips, but they don't want them like suddenly, and they don't want to go to work the next day, because it is instantaneous. It's filler that you inject in there. Mm-hmm. They don't want to go to work the next day and have huge lips. So It's nice to do that gradually, so you can just put a little bit in and kind of stage that over, a few weeks to a few months. It's much more natural that way as well. So you go as big as you want, but if you go gradual, and you can acclimate too, because it's almost like when you got your hair cut off. At first it was like, oh my gosh, what did I do? So it's like,
well, and also like with your lips, I mean, you're stretching skin. You're stretching, so it's like you can't really go from nothing to Dr. Tammy's amazing lips in one session. That took you years to really like a lot of and even with mine, like I've gotten it 3 times, and the first time, like you can see it immediately. But like you're almost filling in like a little part, and then the next time you do it, you can see it a little bit more, and it stays a little longer. Mm-hmm. And this last time, I'm like, oh, there they are. And I'm like, and I love them, and they're just awesome. But it took about 3 times, and so that's why we're doing the special, because like you don't want to, you don't want to just do it one time, unless the special also is like for people who already have their lips done, who may want to get
fuller,
totally. So like there's options for everybody, but it's definitely something for a new person that it's going to take a couple different sessions to be able to get it on point. So
it's fun. It's kind of a little creative, artistic endeavor as well, but it's a nice little gift to give yourself if you don't give it to somebody else, or give it as
but boys gift. Or husbands, or even if you want big lips too, but if not, if you want your lady to have some nice luscious lips, bring her in.
We'll fix you up. We do all sorts of neat things here. One of the other things too is the cannabis world has opened up. Cannabis is medicine. One of the things that, as I was doing my research about cannabis, is that I came to understand that there are over 100 different medicines in the cannabis plant. Didn't have a book for show here, but you can pop one up on that thing. But I've written a book about cannabis and how it works in the body, and as I was doing my research to decide whether I was going to say yes or no to the certifications, I really came to realize that it's not for everybody, but cannabis is a very powerful medication when it's used correctly and used right. So things are really moving fast in Arkansas, and I tell people that if you're going to get a cannabis certification or you qualify, to make sure that you go ahead and do that as soon as possible, because there's only a few doctors in this state doing those certification letters, and there's going to be a huge bottleneck. So when they potentially start sending cards out next month, people are going to be calling everywhere trying to get in, and there's only so many people we can see, and like I say, with not many doctors in the state doing it, it's going to be a bottleneck.
Yeah, I heard it was somewhere around February 20th or late February that they're going to actually start sending out cards. So with our process, it's with our process has been about a 2-week turnaround for you to get your approval letter, and so that might be something that actually takes longer if like you said, if the bottleneck starts to rush in. So just you can go to our website to book an appointment for that, healingartcenters.com. Real easy, just come in, quick appointment. All the information's on there that you'll need. So we'd love to see you and help you out.
Lauren's amazing. She automates everything, which is beautiful. It makes our lives so much easier. So check us out on Facebook. Send us comments, messages. Let us know things you'd like to hear more about, or different informational topics that you'd like us to discuss. We'd love to get your feedback. And we love, Lauren's just telling me before the show that there are people that actually message her that when we tell that we're going to do a second part to something, they're like, well, where's that second part? So that's exciting. Y'all are watching. And we just got some stats. Sorry, I'm going over on our close a little bit, but from KNWA that we are well seen out there in Northwest Arkansas, and just exciting.
We really appreciate our viewers and the engagement.
And well recorded too. You guys are recording it, which is awesome. That means that there's educational value to me that people are actually recording,
which is so important. And we really, really value what you need and what you want to learn about. And we're both all about empowering with education and really helping you understand your body and what decisions to make for yourself, to help you live the happiest life, inside, outside, emotionally, hormonally, physically, on every level. So, we thank you for your support on
Yes, thank you so much. We love you. Have a blessed week, and we'll see you back next week on The Naked Doctor.
Thanks for watching.